Hello, and welcome to Live Like the World is Dying, a podcast that explores life when it feels like the end times. I'm your host, Margaret Killjoy. This week, I'm talking to Zoe Martínez, an anarchist who works in public health in the UK, about the coronavirus. We talk about what self-isolation means and what it doesn't mean, about who the coronavirus is impacting and who self-isolation impacts, and we talk about why you shouldn't freak out, but how you can work to prepare yourself by building resilient communities. I'll get right into it and let them speak for themselves. Thanks for listening. So, welcome to the sort of surprise second episode of Live Like the World is Dying. I was going to wait another week before I put out an episode, but it sure seems like some stuff is happening in the world right now that needs to be addressed. So If you could you introduce yourself with whatever name and pronoun that you would prefer, and then maybe sort of your affiliation, both like politically and also how you're related to public health?
Yep, sure. So my name is Zoe Martínez. I would prefer they, them, please. I am currently working in the UK. My politics are very left, anarchist by preference, and I'm in the very interesting position at the moment of considering myself to be a leftist anarchist working in the kind of public health system of a country that has a right-wing government, and also working within an enormous unwieldy bureaucracy and kind of feeling the weight of that all around me. In terms of the public health side of things, the job that I do at the moment is healthcare planning, specifically with relation to critical care, intensive care. So as I'm sure you can understand, we're getting a lot of calls at the moment to look at the way that coronavirus is going to be impacting on people becoming critically unwell and how they might need to be hospitalized for that.
Okay. Can you start by talking somewhat briefly about what coronavirus is and isn't and kind of what's going on?
Yeah, sure. So coronavirus, or Wuhan novel coronavirus, as it started out being known, you may see it now referred to as well as COVID-19, is a new virus that has emerged in China. It's a kind of respiratory illness. So it's an illness that tends to affect the upper respiratory tract. So it would affect your throat, your nose, can then go down and settle on your chest. And some of the symptoms that are being reported will be shortness of breath, difficulty breathing, a persistent cough, and also some of the other symptoms then being the kind of feverish symptoms of aches and pains, chills, high temperature. It is known as novel coronavirus because it was only discovered earlier this year, or possibly towards the end of last year, actually. And it is something that has apparently emerged in a crossover between other animals and humans. So it kind of jumped the boundary between animal to animal infection to animal to human infection, and is now being transmitted from human to human.
Okay. So the important question is, should everyone freak out about this?
That's a very good question. I think the simple answer to that is no. If you were not freaking out about flu, then you probably don't need to freak out any more about this. And in fact, given the kinds of measures that are being put in place at the moment to try and contain the illness, I think you could probably freak out about this a little less. Generally speaking, for around about 75% of the people who contract this illness, it's like a bad cold. It makes you feel crappy. It will feel like you just want to curl up in bed. but for the most part, it's not going to cause any severe problems. It's about 25% of people who will go on to develop some kind of severe symptoms or complications. And the severe symptoms and complications are usually going to be in the same kind of groups that you would see complications for another kind of illness like this, like flu. So it would be people who have got other chronic conditions like kind of chest problems, heart problems, diabetes, but also significantly older people whose health is more fragile, and also very young children.
Okay. So one of the main ideas of this podcast is a sort of, leftist and anarchist prepper podcast in some ways, basically about how we cope with what feels like the end times to some of us. So this kind of came as it's only been in the past month or so that this has been talked about. What can people do about this, either personally or on a community level?
I think that it's interesting looking at some of the guidance that's coming out, particularly in terms of sort of self-quarantining and self-isolating. Mm-hmm. So in practical terms, what that generally tends to mean is you stay in your home, you don't go to work or to school, you try to stay off public transportation, you try to avoid having people over to your home. Of course, this is going to have an impact on people who are trying to exist in a sort of low wage economy. Sometimes staying in your home is not going to be practical. Mm-hmm. Staying off public transportation isn't going to be practical. I think that at a personal level, some of the things that people can be doing is to try and be vigilant in the same way as you would be for any other kind of ill health problem. So if you see somebody coughing and spluttering and sneezing, you probably just want to give them a bit of a wide berth. If one of the things that would probably be advised for a wider spread outbreak, and this may come in the kind of coming weeks or months, is staying away from places where there are large gatherings of people. So, clubs, bars, big rallies, thinking particularly about the activist community. If you've got some kind of activist activity coming up, then you might want to rethink some of that and try and plan that around making sure that you're not having a big gathering of people together. The basic common sense stuff here is to just practice the same kind of good hygiene that you would do normally. If you're going to cough or sneeze, do it into a tissue or into the crook of your elbow. Make sure you're washing your hands regularly. Don't get up in the space of somebody who seems to be sick is probably the best thing that you can do. One of the other things that kind of came to mind as well, because the whole thing around self-isolating, it made me think a little bit of the outbreak that we had in England of the plague, the bubonic plague, where there was a known village in the middle of right smack bang in the middle of England that had an outbreak of plague.
Wait, recently?
And one of the Oh God, no! Sorry. So no, this was back at the time when the plague was rife, and was spread incredibly widely. And for some reason, there was somebody within the village who went, "We should have no contact with people outside our village, but obviously we're going to be reliant on them for supplying us whilst people in the village are sick." Mm-hmm. And what they were doing was they were putting money wrapped up in fabric that had been soaked in vinegar at the border of the village, and the outside villagers were coming in and leaving food so that they could take it back in. Mm-hmm. So one of the things that they're saying about self-isolating is asking friends, asking family members to bring things to your home. And, we are kind of in a more technological age. We can kind of go, "Hey, I'll PayPal you some money. Can you please collect me some groceries and leave them on the doorstep?" Mm-hmm. So kind of calling on your support networks, if you have them, building those support networks to make sure that you are supported, that you can support the people in your community, so that if this does start to spread more widely, we know that we've got those networks in place and we can rely upon each other.
But someone's still delivering the food in that sense, aren't they then not self-isolating? Like the person who has to go to the grocery store, is it like the job for the more healthy person or something like that?
Yeah, that would be the job for the more healthy person. So being able to get a message out via, some kind of text-based means, or calling your friends and saying, could you stop by the grocery store and pick me some stuff up, and then literally knock my door to let me know it's there and leave, means that you can pick those things up without exposing anybody else. If you think that, if you're either sick or you think that you may be at risk, will help to support you so that you're not basically trying to tough out what is likely to be quite an unpleasant illness in your own home without any support, but you're also not exposing anybody else to the risk of infection as well.
Okay. Because last night was actually the first time I started really reading articles that didn't seem like scaremongering about this sort of stay-at-home model, the like social isolation model of how we as a community deal with a disease. And what's funny to me is that it goes against most of what I understand about disaster and like apocalyptic survival in general. Like I generally am against the sort of bunker mentality, but it's interesting when you have this really specific threat model of illness, where that suddenly becomes a useful thing. But when I was talking to my friend about this last night, one of the things that really came up was, he was talking about how he's planning on self-isolating soon, just kind of because he's reading these articles about how in order to, and you maybe know more about this, and if you could explain it, I'd appreciate it. I think it's called the R0 or the R0 number, the number of people who get infected, the number of people that any given infected person infect, and how we can flatten out the curve to try and minimize harm. Do you know a bit more about that, or want to talk about that?
Sure. So the kind of self-isolation and quarantining seems to have done quite a lot to kind of flatten that curve out. So when the reports first started coming out of the Wuhan province in China, it was kind of startling, the figures, in that they seemed to be doubling every 24 hours. So, you had what they would call patient zero. The following day, they had 2 people that they'd been in contact with who had become infected. And then you had double that number and on until they kind of got to the point of realizing that this was a highly infectious illness and they needed to do something to try and contain the spread. We're now looking at something that doesn't appear to be anywhere near that bad. So just talking about the UK specifically, we've repatriated 2 people into Scotland who were put into immediate sort of quarantine and isolation. We now have 15 confirmed cases in the UK, and that's been over the entire duration of the kind of virus spread. And so far we haven't had any kind of within the country person-to-person transmission. So all of the cases that we've had in this country have been people who have come back from a country that has already had a spread of the infection. So either kind of East Asia, or now we're looking at sort of northern Italy as one of the areas that seems to be having the infection. So self-isolating does seem to be a useful way to kind of reduce the spread, but it seems to be something that is more beneficial if you think you may be at risk of transmitting the illness, rather than as a kind of precautionary measure against contracting it. You don't basically need to take to your home and batten down the hatches in case you get it. I think that the model here is that if you think you may be at risk of having been exposed, that's when you kind of take yourself out of circulation.
So it's sort of almost like a writ large version of the thing about face masks. Everything I've been reading about face masks say that face masks are far less to keep you from catching a disease and far more for keeping you from spreading a disease.
Very much so. So the reason why you would see, a physician or somebody using a face mask in a hospital is to stop them from infecting a patient that has open wounds, for example, by, accidentally sneezing on them or breathing on them or whatever. There is one type of face mask which tends to be used in hospital settings, particularly for clinical staff who are caring for patients that they know have an infectious illness. It's called it's called an FFP3 mask. So it's a particular kind of very close-fitting respirator mask, which is thought to help to reduce the chances of breathing in somebody else's infected secretions in something that's thought to be airborne.
Could you say that number again? Your voice went robot.
It's an FFP3.
FFP3.
Yeah, great. So it's a particular kind of face mask. You can buy them on the internet if you want to. But the important thing with those is that if you just buy one and have it shipped to you, you need to make sure that it is a proper fit on your face. If you just buy one and put it on just as it comes, it's still not going to be making the kind of air seal that it needs to in order to keep everything out that you would want to be kept out. And you need to change them pretty regularly as well. So the big thing about face masks really is, if you think that you may be infected and you have no choice but to go outside, then stick on your face mask to try and stop from passing it on to somebody else rather than as a preventative from you getting the illness.
Okay. So you would say that self-isolation is not about everyone listening to this podcast should now go and not leave their house for the next 2 months. You're saying that maybe preparing to be able to do that in case you either are more at risk yourself or are at risk of spreading it?
Yes, absolutely. So, the kind of preparations that they're saying that generally speaking, if you think that you may have been exposed to the illness and you may be at a risk of developing it yourself, you should be looking at isolating yourself for 14 days after exposure or potential exposure. So having some things in your home to keep you going for 14 days if you feel as though you don't want to go out for that time in case you become a risk would probably be a useful thing to do. I think as well that, one of the things that struck me about the kind of the rhetoric about staying in your home and self-isolating is that we're in quite a fragmented society these days. The idea of having friends or family members who can run errands for you or collect your groceries or medications, it's going to be, people of color, queer people who are isolated from their communities, disabled people may struggle with that kind of social backup of having people to support them. So I think if people wanted to be doing anything for the next 2 months, it might be organizing in their communities to say, just check in on the people who live around them and go, hey, do you need some kind of support? Here's my number. If you find yourself in this position, I'm a person you can call on, and making sure that you have those numbers in your phone as well, so that if you find yourself in that position, you know that there are people who can support you. Okay.
So that's actually, it's interesting because that ties into something that hopefully I'll be talking about more on the show with people, is building kind of resiliency networks with neighbors and with community, however you end up defining community. How is so it's interesting because then like in the US you have, I don't know how it is in the UK. The US has this tendency to view the rest of the developed world as sort of utopian in its health care, access to health care. I remember having a conversation with a friend of mine who is sort of independently wealthy, where he was very frustrated with another friend for going to work while sick because it was, wildly irresponsible to put other people at risk. But my other friend can't not go to work for 2 weeks just because he has a terrible illness that's contagious,
Yeah.
And I don't know, there's been a lot of conversation happening about how the coronavirus and governmental response is really showing a lot of the flaws, at least in capitalism, if not in sort of capitalist government. And I'm wondering, you might have a different position coming from the UK, or a different perspective, but I'm curious.
I mean, I think that certainly taking sick days is slightly more normalized in the UK than it might be in the US, particularly. But even then, according to the kind of UK benefits system for, payment of sickness benefits, you have to have been sick, unpaid for 3 days before the kind of basic level of sickness pay would kick in. And at that point, it's going to be something equivalent to about $40 a day. So you're not looking at going, oh, it's all right, I can take a whole bunch of sick time and I'm going to be reimbursed handsomely and I can just sit at home. It's, it doesn't work like that in this country, but even less so from what I can tell in the US. And I'm thinking particularly, for people who are dependent on working in the service industries, and particularly places where a significant amount of the income that they make is reliant on tips, for example. Trying to drag yourself through an average workday is pretty difficult. Trying to drag yourself through a workday and be pleasing enough to the general public to attract tips when you're feeling awful is, it's not a great prospect, really. But quite aside from that, it is, I think that is where the US in particular, but I think a lot of other areas of the kind of Western industrialized world are going to see the problems here is people who are saying, yeah, it's all very well for you to tell me to stay at home for 14 days if I've been exposed, but I'm going to lose my house if I do that.
Right.
And, that is going to be a genuine problem.
Yeah, I mean, I think about everything I've read says that the death toll of this particular illness seems to be at around like 2% overall.
Yeah.
And I know that probably myself and most of the people in my sort of immediate circles would have to make the decision of taking an increased chance of having a 2% chance of dying over losing their jobs, losing, their housing, losing their ability to survive, So I think that there's a fatalism, at least in the circles that I'm in, where everyone, and maybe we say this because, I'm in my late 30s, but I'm healthy, by most standards. So there's a fatalism of like, well, I'll probably get it and I'll probably get over it, and it's actually only this kind of flattening the curve mentality and this kind of not herd immunity, but like this concept of by avoiding getting it, I can avoid passing it to people who are more at risk is actually the first time that I've considered taking it seriously. I mean, I took it seriously, but I took it seriously as this like, well, apparently my chance of dying this year went up from about 1% to about 2%,
Yeah.
But now I have to think about kind of community responsibility as relates to it.
Yeah, and I think that's the difficult thing here is that, you have a largely Western capitalist society that has told us to privilege individuality and, I've got mine, so I'm okay. And then is suddenly flipping that on its head at a time of public health emergency, for want of a better word, or higher risk, and saying, now you have to privilege the community and considering what is best for the people around you over your own needs to survive. That's a pretty big flip in not very much time for people to have been told, well, you can't expect to be responsible for anybody other than yourself, and you can't expect anybody else to be responsible for you, to then suddenly be told you are potentially risking other people's lives by going to work when you're sick, even though you know that you're not going to be able to meet rent payment if you don't.
Right.
So yeah, that's where I kind of see this into. I mean, quite aside from the kind of fragmented community side of things, the other aspect of that is that, except in sort of small pockets of local organization and, organization along the lines of political identity or, personal identity, there doesn't feel as though there is that greater sense of community. So suddenly asking people to take responsibility for the people around them when they've always been told that they don't need to be responsible for anybody around them and nobody is responsible for them. It's quite a big mental leap to make.
Yeah. Yeah, I mean, it's fascinating to me because I think we're living at this time right now, even before adding disease vectors, just thinking about climate change and refugee crises, that we're being forced to either become nationalist or internationalist. Like the center is like no longer really a viable option. And I think that people are choosing between a like sort of nationwide bunker mentality and like erecting walls or leaving unions or whatever, to use my country and your country as examples, versus an internationalist, let's all pull together and try and stop this. And I clearly have a position on this. I'm clearly on the side of internationalism. And I think that the flaws of nationalism are going to become more and more clear in the coming years. But this health crisis actually seems like one of those times where this I've got mine, fuck you mentality is like flawed and not going to work. And I keep thinking about, this is sort of a tangent, but for the past couple of days I've been like obsessively thinking about The Mask of the Red Death, the Edgar Allan Poe story, where they like all of the rich people go hide in a castle to get away from a disease, and then they're like, didn't work.
Yeah. Yup. I mean, the thing is, at the end of the day, even all of the rich people in their castles need somebody to bring them food and, keep them going. And it is going to be those people who cannot afford to not do that who are going to bring the disease to the rich people who thought they'd escaped.
Yeah.
So, yeah, I think the interesting thing about the kind of nationalism versus internationalism thing, I've been reading some of the reports from what's been happening at the US borders, for example, where they're saying, well, you look a bit Asian, so maybe we shouldn't let you into the country, even though you've actually just been from, Washington to Seattle and, you've lived here all your life. But that kind of idea of using an international border to prevent the spread of an illness from one place to another, actually, if we were working better as locally organized communities, we would be able to have the kind of resilience that you were talking about to say, one of our number is sick, they can't afford to be doing stuff right now, they're going to isolate, we're going to make sure that they've got all of the stuff that they need until they're ready to re-emerge into society, and hopefully that will contain the illness, and if it doesn't and somebody else gets it, then it's their turn for all of us to care for them. Rather than just kind of going, okay, well, something scary happened, so we're going to pull up the drawbridge and nobody else can come in, and we're going to side-eye everybody who looks like they might have a sniffle or like they might come from a country that we read as being a problem.
Right.
That just doesn't seem to make sense to me.
Yeah. Can you talk a little bit about, so you work with large institutions rather than at the community level, and you mentioned in your introduction that it's sometimes frustrating to deal with these large bureaucracies. Can you talk about public health sort of writ large on a governmental level, and what's been working and what's not been working?
Yeah, so I think that it's interesting in some ways. So if you look at the kind of clinical aspects of this, so the people who are doing the surveillance hands-on, doing the testing of samples and sharing that information, looking at prevalence and incidence and spread and how this thing is growing, looking at developing guidance for how people should be dealing with this, whether it's in the community or if it's in like a hospital setting. I think that's where you start to see some of the real benefits of internationalism. Mm-hmm. So some of the guidance that I've been looking at in my small area of the world has been developed very locally by people who work around me. Some of it is developed at a UK-wide level. Some of it is kind of European. Some of it is World Health Organization. And this is where you have, clinical people who have contacts across international boundaries who are working together and supporting each other to get the information out there and, making sure that as much good information is circulated as possible. Then you look at the organizational side of things, mm-hmm. and you're trying to deal through governments and government agencies who are looking at this from the perspective of quite often minimizing risk to politicians rather than minimizing risk to populations. Mm-hmm. I was reading something a couple of days ago about how I can't remember which kind of committee it was now that was taking some kind of presentation on this in the US, where they were saying, don't worry, it's not going to have a big effect on people's stocks or on investments. It's all going to be fine. You will keep all of your money. Don't worry. Yeah. And it feels as though, I agree that we should be managing people's fears around how much of a risk this is and how big of a problem it's going to be for people, but not for the purposes of trying to make the politicians look good, right? And for keeping the stock values level and all of that kind of thing.
Yeah, I'd rather keep my elderly family and not money.
Yes, please, that would be good. But you also have the situation, and I'm just looking at this within UK, which is a relatively small area of the world, and even across the UK devolved nation, so England, Scotland, Wales specifically are the ones that I tend to have most dealings with. If something comes out of the English Department of Health, it then has to go into a process of going into the Welsh government for them to say, okay, well, do we agree with this? And is it Welsh enough? And should we be thinking about doing our own research on this? And does it make us look good? And should we be using it? So rather than just going through the process of going, okay, these people who are learned and know things have issued this information, we should just run with it, right? Mm-hmm. They then have to go through a process of deciding whether or not, from an organizational and political perspective, that feels like the right thing to do in order to serve their kind of political paymasters. Mm-hmm. And, decision making in hierarchical organizations is tortuous on a grand scale. And just thinking about it from, I was exchanging emails with a colleague of mine who works in a government agency and saying, hey, so you said that because in intensive care we may be taking on more patients and we need to make sure that we can increase our capacity. You said that there might be some money available so that people can buy equipment so that they can equip those extra beds so that we're ready to be there and respond if this 25% of the infected population end up coming into hospital. Mm-hmm. And yeah, that was about a week and a half ago, and I've not heard anything since. And that will probably have to go through some subcommittee of a committee that has to make a decision that is scrutinized by 15 people. And then I will have to wait for the money to be issued. And So that kind of bureaucracy sort of slows down being able to do anything practical in order to prepare for the inevitable consequences of if this thing goes big.
Right. Whereas you're saying basically at the local level, you all have a good sense of what you need, and you could probably say, this is what we need, just give us the resources. But instead it's has to be kind of handed down upon from high.
Yeah. So I think it would be fair to say that it's kind of the middle tier that is the problem. So you have at a local level, you have local communities who are going, this is what we need. At an international level, you have people who are, working in research and working with the data who are saying, this is what we've learned and this is what we think is going to happen. And in the middle, you have a bunch of people who are chewing on the ends of their pens, wondering what they should do about this and trying to put it through some kind of a committee process.
Yeah, I mean, it's interesting. I've been trying to figure out, as I read articles and things about this, to what degree, like in the US, we're having this problem where apparently the tests that we've developed to test for this particular coronavirus are not particularly accurate. And so all of the testing is happening in like one place in Atlanta nationwide, and all the ones that are being instituted elsewhere are like fallible. And it's interesting to me because I'm trying to figure out why we're replicating this work. Like, why does the US have to develop its own tests? It's a I don't know. It seems staggeringly stupid to watch people cling to institutions that are. It's the same with climate change, where I'm like watching people cling to institutions that are literally going to murder the entire world. And I don't know.
Yeah, no, it is crazy. And I think that in some senses, I think there is some kind of institutionalized sort of psychological need to control the uncontrollable. We kind of know that we've been waiting for a major outbreak of some kind of an infectious illness for really quite some time. We had a pandemic of influenza in 2009, 2010, that even though it severely tested, the ability of services to deal with that, it was still, it wasn't your Spanish flu. It didn't wipe out millions of people in the population. So we've been waiting for this to come along for a while, and now it looks as though it may be here. It feels as though there is this kind of not dealing with what is in front of you, which is, okay, there's this existential threat. It's like, okay, well, let's engage in some displacement activities like replicating work that's been done elsewhere so that we can feel as though we're in control of it. Whereas actually we're not doing anything that is really useful, but it feels like we're busy.
That's fascinating. That's dark and sounds accurate to me. I mean, what you're talking about the like community level and the international level being the levels that like have a better sense of what's going on than the sort of like national level. That I mean, I have this very strong bias towards looking for things that reaffirm my worldview, but that certainly reaffirms my worldview as an internationalist and an anarchist. Where I'm like, no, it's like we should figure out shit all together, or at the community or individual level. It's like the little weird nationalist shit that is the mess.
Yeah, and it's the kind of, at a national level, it's really weird because, just thinking about it from a UK wide level, you're trying to come up with some kind of strategy or plan for that you can just say, okay, we're going to implement this across the whole of the UK. And then you go, okay, well, some parts of the UK have an incredibly high density of population. From UK perspective, we're not talking about Mexico City levels of density of population here, but, you've got London on the one hand, and then you've got the Highlands of Scotland on the other hand, where you have two completely different sets of challenges, where in London you're potentially going to be looking at people falling over each other just trying to exist and potentially infecting each other left, right and centre because they literally can't keep out of each other's way.
Mm-hmm.
Whereas if you're looking at the north of Scotland, where there's like one house for every 25 miles,
Mm-hmm.
your risk there is that you have an older person who is in a really rural, isolated location whose ability to breathe for themselves suddenly goes rapidly
Right.
downhill, and it's going to take 4 hours for some kind of medical assistance to get to them.
Right.
And if you're planning at a community level, the last thing that I would probably say, just to sort of go back to the start of what we were talking about at a kind of individual and community level, I don't think that this is, this is going to be an illness. It's likely to have a big impact. But I don't think that people need to, hightail it off to their bunkers and hide away until it all goes away. I think that we need to be reasonably prepared, that we need to try and care for each other and our communities as much as we can, and that you just need to kind of take things as they come and respond to that, rather than responding to the kind of understandable panic about this unknown thing that is coming over the horizon. Because whilst it may be, unpleasant and have a big impact, I don't think that individually it's going to be as bad for as many people as people think it's going to be.
Thanks so much for listening. If you like this podcast, please tell people about it. Word of mouth is certainly how I find out about all the podcasts that I listen to, and maybe you have that experience too. So if you want more people to have this information, you should tell people to listen to it, especially at the beginning of a new podcast like this. I feel like that's particularly important, and I know I'd be very grateful. I also have another podcast. It's called We Will Remember Freedom. It's a monthly anarchist fiction podcast, and it's short stories that I find by other people that would appeal to an anarchist audience. Then I interview those authors about those stories afterwards. The main way to support this podcast is through my Patreon, which is patreon.com/MargaretKilljoy. That's my main income, and I'm eternally grateful that I'm able to spend a good chunk of my life working on projects like this. So please help me do that if you would like. I think that this podcast will be pretty much weekly, and join us next week when I talk to a New York City anarchist and activist about what disaster preparedness means in an urban environment, and how maybe actually that might be the safer place to be for most threat models. All right, thanks so much.